Happy Friday. Here's a little something to know about trauma during labor and delivery or postpartum, even during pregnancy actually. Most of the clients that I get who come to therapy to process trauma from this period of time communicate with me a few common experiences that happen to them. And by the way, trauma is always in the eye of the beholder, which means you might have a mom who was calm, cool, and collected during birth and registered it as trauma. You might have a mom that was hollering the whole time and it seemed really overwhelming, but she comes out the other end saying, oh my gosh, I felt so empowered. That was incredible. I can't wait to do that again someday. You just never know. But the few things that are really common among women that report it as trauma in their system is that they either felt completely terrified at some point for themselves or for their baby, or they felt like they had no choice or voice or power, like they were at the mercy of the providers and they didn't know what was happening and nobody was communicating with them and people were doing things to their body that they didn't consent to or didn't anticipate or didn't know was going to happen. And the third thing, and I would say this is maybe the most common, is that they felt alone. The alone piece is really important because studies show that people who do not feel alone during experiences that would otherwise be registered as trauma actually don't as often feel like it was trauma because they were not alone. The power of with is incredible. So if you're a partner or a medical provider or somebody on this mom's team, my plea to you is that you really show up for her during labor and delivery and especially postpartum, and that you don't try to fix her big feelings or anything, but you're just with her listening. And you also give her the space to ask questions, give her the space to advocate for what she wants and needs, and that you're just there to listen and be an emotional support to her and believe her. And mamas, if you did experience trauma, and dads too sometimes experience vicarious trauma, then I hope that you can find someone that specializes in perinatal mental health and trauma, and you can get it processed because you don't have to live with this trauma gripping you for the rest of your motherhood journey.